Again, this show, we're talking about New Year's resolutions. Have you made your New Year's resolution? Are you going to lose weight? Are you going to exercise? And the other thing that I know I hear a lot of is, I'm going to stop smoking. Smoking is probably one of the hardest things for people to try to stop. And I'd like to welcome our guest today, Connie Hadden. Connie is a employee of BMG, Baptist Medical Group. And Connie, we're very happy to have you here.
Thank you.
Now, Connie, when did you start smoking?
Well, I tried it at the age of 12, but actually started smoking full time when I was 16.
And when you were smoking the most, about how much were you smoking?
About 2 packs a day.
2 packs a day for how many years?
Oh, probably the last 15 years. That's a lot of money.
They're expensive, aren't
Yeah.
they? Well, what made you decide to want to stop smoking?
I did it because of my health and because of the way it looks. You know, I looked at myself in the mirror holding a cigarette, and I didn't like what I saw.
You know, it's very interesting. Back in the 30s and 40s, it was cool to have a cigarette. Humphrey Bogart had a cigarette. But nowadays, it's not so cool.
No, you look horrible holding a cigarette.
Well, Connie, tell me about the first thing that you tried to stop smoking.
There was a antidepressant medication that I tried. It didn't work. I tried patches. They didn't work. Because until you set your mind that you are ready to put those cigarettes down, you can try anything you want. It's not going to take away what the urge, the need. That's all up here.
Now, it's very difficult sometimes for people that are non-smokers to understand what Connie is talking about. Fortunately, I've never been a smoker, but the smokers that I talk to tell me that it's the most addicting thing and the hardest thing to stop. Non-smokers just don't really understand that, but
they don't have a clue.
What's the attitude about that with smokers? With
smokers, when you have that urge to have a cigarette, if you don't satisfy that urge, you're mean. You'll fight someone for a cigarette. To me, it's comparable to an addiction to a drug.
Well, there's been studies that shown that cigarette smoking is comparable to like cocaine addiction.
My family, bless their hearts, when I would try to quit and I didn't have the mindset and the strength to really do it on my own, I thought, well, I'm going to take this medication. It's going to get rid of everything, and I'm going to get rid of smoking. And I would be so ill, you know, you couldn't say good morning, it wouldn't be the right way.
How many times do you think you stopped and restarted?
Oh, probably 10 times or more.
Really?
Yeah. Oh, I hated smoking. I liked smoking in the fact that when I was nervous or upset, I could smoke a cigarette, it would calm me down. But knowing that I was a slave to something that, you know, I couldn't go to certain restaurants because you can't smoke. You know, you have to go outside to smoke. You know, you can't go to the movies because you can't smoke. And in the middle of the movie, you have this urge to smoke, so you have to go outside and smoke, and you miss part of the movie. It's truly a slave.
Well, Connie, I got one question. Did you ever read that little thing on the side of the package of cigarettes?
I did. It didn't apply to me.
Oh, it didn't. You were the one you were going to skip that.
Yeah.
Because if you read that on the side of the cigarettes, it says, "This will kill you, dummy." So don't do that.
My doctor told me that a lot too.
Oh, your doctor told you that?
Yes, he did. He
well,
sure did.
Connie, eventually, how did you stop, and how long have you been quit?
I've been quit since April of last year. So I've been quit. This April will be 2 years. I got on some medication, and I started on it, but I also set my mind that I was going to do it. I did it one day at a time. Each day that I didn't smoke, I would say, I quit smoking. This is day one. I made it through day one. I made it through day two. You do it one day at a time. You don't look down the road and say, well, I'm going to look towards, I'm going to be a non-smoker in 6 months. You do it daily.
Well, I just want to say congratulations. And I just want to tell our audience, there's a lot of things you can do for your health with diet, exercise, do the things your doctor tells you to do. But I'm telling you, If you're a smoker, one of the most important things that you can do in this new year is to please stop smoking.